Hi everyone, welcome to a new video. In this video I'd like to answer a question that I received regarding bronchial asthma. So asthma, can you have asthma without knowing that you have asthma? And this is something that's a little bit strange, but this question has come up on my other channel. And I think it's an important question because a lot of people may be struggling with different respiratory symptoms, but they don't actually go and see a doctor. Or there may be cases of occupational asthma in the sense that, for example, you've started a new job, for example, 3 months, 4 months, 5 months ago, and then suddenly you start to develop some respiratory symptoms and you don't know what it is, but it could be occupational asthma. Now, of course, what I'm telling you here may not apply in your case, so please see your doctor if you have any issues that worry you regarding your health. But I'm just saying that asthma can be sometimes undiagnosed. And it's a very, very important thing to question. So just to clarify things a bit, what would be some symptoms that would make someone think that they may have asthma? Because this is probably a good starting point. First of all, just to mention that asthma usually has symptoms that don't occur permanently. They have patients who have asthma, they generally have symptoms that wax and wane. They may have good days or bad days. They may have something like an attack where their breathing is a little bit labored and then they feel a little bit better. It may be related to inhaling some dust around the house or some other allergen. So that's when the symptoms occur. So they tend to go up and down. Now, some of the common symptoms that people with asthma experience are a sensation that you can't really catch your breath. There's a bit of a sort of a chest tightness, constriction. Your chest feels a little bit tight. You may have wheeze. This is the most common one that people associate with asthma. So your breathing may sound a little bit like you may have these sounds when you're trying to get the air out. And then some people do not have these symptoms, but they may have episodes of cough. And it may just be induced by some allergens they inhale or all kinds of things like that. So sometimes you may have these symptoms which are very mild. They tend to come and go. You don't actually take any treatment. Sometimes they can be induced by exercise, especially in younger people, but it's not the type of breathlessness that occurs when you're sort of running and you're breathless. Usually exercise-induced asthma occurs a little bit after you've stopped the exercise. So not usually occurs when you're running actively or doing something strenuous. You generally stop, you're resting for a few minutes, and then your breathing starts to go off a little bit. So these are just a couple of things to make one think that, asthma is a possibility. And if you have any symptoms that really bother you with regards to your breathing, I would say the best port of call is to go see your family doctor or a doctor you trust, a doctor you know, to just have a conversation. You don't necessarily need to consider that definitely you've got asthma and you need to be treated for asthma. You may not require treatment, or it may be something else. Or, you may recover spontaneously. There may be some change in your life that you need to make and things will be better. So usually the first step when you're going for a consultation, when you're going to see a doctor, I really encourage you to just go to talk to a doctor. Not necessarily to expect that you'll get a treatment or you get a lot of tests done, just to have a little bit of a chat. And you can always say no, I don't want to have a lot of investigations. But that first step, going to the doctor's office, stepping into that office, telling them your story, getting a medical opinion is very, very important. It may very well be asthma if you're experiencing symptoms like I've mentioned before, or it may be something else. But there's only one way to find out, by going to see your doctor early. Do not wait for too long, because asthma can sometimes, if you leave it untreated, because it's an inflammatory condition of the airways, at some point that inflammation may turn into more fixed damage, and that's a little bit harder to treat. So you're thinking long term, what will happen 5 years, 10 years, 20 years from now? I think it's important to seek health early. Hopefully this was a helpful viewpoint, and I'll see you in future videos. Thank you for watching.